Calcium channel blocker overdose. So calcium is one of the more common electrolytes within your body. It is a positively charged electrolyte, which makes it a cation, and it plays a huge role in muscular contraction. It's what gives those muscle cells that kick. It also plays a large role in your communication within your nervous system, and it plays a large role with hormonal regulation, and we're going to circle back to that later. Calcium channel blockers are super common medications that throttle calcium's ability to move through calcium channels in the cell's membrane. And there's generally two classes that we're concerned about here: dihydropyridine calcium channel blockers and non-dihydropyridine calcium channel blockers. Dihydropyridines act on vascular smooth muscle. So if that smooth muscle doesn't get that kick from calcium, they can't maintain their tone, and blood pressure lowers because of that loss of peripheral vascular resistance. That makes dihydropyridines great medications to prescribe to control blood pressure. And the most common dihydropyrimines that you will see in the field are amlodipine, which is one of the most prescribed medications in the US, nicardipine, and nifedipine. With non-dihydropyridine calcium channel blockers, we have two subtypes: phenylalkylamines and benzothiazepines. The phenylalkylamine that you'll see in the field is verapamil. Verapamil acts on cardiac muscle and specifically targets inotropies. Also, to a lesser degree, will target vascular smooth muscle. It's often prescribed to control hypertension when a person has atrial fibrillation. The benzothiazepine that you'll see is cardizem. And cardizem kind of exists in the space between cardiac effects and vascular effects, which makes it a good medication for hypertension and atrial fibrillation. Now, there's other types of calcium channel blockers out there. Neurontin or gabapentin is a type of calcium channel blocker, so is Lyrica, but those are really beyond the scope of what we're talking about here. When it comes to overdose, cardizem and verapamil are associated with higher rates of mortality as compared to medications like amlodipine. But when you take medications like amlodipine in high enough doses, they lose their specificity for vascular smooth muscle, and they just become big, dumb calcium channel blockers like everything else. Now, when you think of the role calcium plays in muscle contraction, you can really imagine how a calcium channel blocker overdose would affect the body. It would cause significant cardiac depression. It would lower heart rate. It would lower cardiac contractility. It would cause AV nodal blockade because the AV node is made up of calcium channels. It would cause a complete loss of vascular tone. It would cause profound hypotension. And then your generic toxicity symptoms like nausea, vomiting, mental status changes, which is kind of a late stage sign with calcium channel blockers. Now, here's something people don't think about a lot when it comes to calcium channel blocker overdose. Calcium plays a huge role in promoting insulin release and insulin usage by the body's cells. So if a person overdoses on calcium channel blockers, their body can stop releasing insulin and stop responding to insulin. So not only is the muscle cell's electrical stimuli to contract impaired, but it doesn't even have the energy to contract anymore, which makes high-dose insulin therapy a primary component of treating calcium channel blocker overdose. EMS treatment is focused on increasing blood pressure, increasing heart rate, and counteracting calcium channel blockade. So that means administration of fluids, administration of calcium, pacing, and setting up pressors, and specifically catecholamine pressors with inotropic effects. So epinephrine, norepinephrine, and even dopamine if that's all you have. Sit down, dopamine! Even a clock works twice a day. Administration of insulin also requires administration of dextrose so the patient doesn't become hypoglycemic. Follow your local protocols and always call poison control. And I will post a Life in the Fast Lane resource in my bio.